Hi, I am Dr. Akhtar and today's topic is episclera and sclera. First of all, anatomy of the sclera. The term sclera is derived from Greek word scleros. Scleros means hard. Sclera is opaque, elastic, and resilient tissue of the eye. It can be compared with an incomplete shell comprising about 90%, about 5/6 of the outer coat of the eye. This is outer coat of the eye, and this is 1/6. This 1/6 forms the cornea, while the remaining 5/6 form the sclera. So it forms about 90% of the outer coat. Anteriorly, it begins at the limbus and terminates at the optic nerve canal posteriorly. The primary function of the sclera is to protect the eye and maintain the shape of the eyeball. An amazing fact about sclera is that human beings are the only primates with white sclera. Sclera is also attachment sites for the extraocular muscles. Embryologically, like corneal stroma and endothelium, sclera originates from the mesoderm. The human sclera is white in color. This white appearance is because of the scattering of all wavelengths supplied by dense irregular bundles of collagen in sclera. In children, a bluish hue is observed because of the extremely thin sclera, which allows the visibility of underlying choroid. In old age, the sclera may appear slightly yellow because of the deposition of fat. Thickness of sclera. Sclera is thicker in males than in females. Human sclera is thickest near the optic nerve, here, where it is approximately 1 mm in thickness, and thinnest at the insertion of the extraocular muscles, here about 0.3 mm. The tendon of the extraocular muscles are of the same thickness here at this point of insertion, so with merging of these tendons, the collective thickness of sclera reaches to 0.6 mm here. Sclera gradually thickens towards the cornea, and at the limbus the thickness of the sclera is 0.83 mm. Important note about sclera is that scleral rupture following trauma primarily occurs immediately behind the insertion of the recti or in the area parallel to the limbus. Now the structure of the sclera. Ultrastructurally, sclera can be divided into three parts. The first one is episclera. The episclera is a thin, densely vascularized layer of connective tissue overlying the sclera and situated below the tenon capsule. Apart from the vessels and unmyelinated nerve fibers, it contains bundles of collagen and also cells like fibroblasts and occasionally melanocytes. So it contains also melanocytes and fibroblasts. Anteriorly, episclera blend with subconjunctival tissue and tenon capsule 1 to 3 mm behind the limbus. 1 to 3 mm behind the limbus. It becomes very thin and indistinct posterior to the equator. Episclera is supplied by the anterior ciliary arteries anteriorly, and posterior ciliary arteries supply the posterior part. Scleritis is always accompanied by an overlying episcleritis. On the other hand, episcleritis is very rarely associated with scleritis. The second part is sclera proper. It is also called scleral stroma. It is also called substantia propria. Ultrastructurally, sclera is composed of collagen bundles, elastic fibers, fibroblasts, ground substances. These ground substances are proteoglycans and glycoproteins. Collagen bundles in sclera are of varying size and are irregularly arranged. The reason why sclera is not transparent like cornea. These variations in scleral collagen fibers are more marked in mid-sclera, where the diameter of the fiber range from 50 to 400 nanometer. The scleral fibroblasts play an important role in synthesis and organization of collagen, proteoglycans, and glycoproteins. So this is episclera, this is tenon, and this is scleral stroma. These are the fibroblasts. There are type 1 collagen and type 3. Type 1 collagen fibers are thick and tightly packed and are responsible for providing the sclera with its tensile strength, while type 3 collagens are thinner than type 1 and are more loosely packed and responsible for allowing the sclera to stretch and deform without breaking. These are the collagen fibers. The third layer is lamina fusca. It is the innermost layer of the sclera. It is characterized by the abundance of pigmented cells or melanocytes, mostly migrated from choroid. The connective tissue of this layer is loosely arranged in the rest of the sclera. Lamina fusca is separated from choroid by a thin potential space known as suprachoroidal or perichoroidal space. Lamina fusca is separated from choroid by a thin potential space. The regional variations in thickness and composition: thicker and more heavily pigmented in the posterior. Sensitive retina and the optic nerve require greater protection and support than the anterior part. So that's why posteriorly sclera is thicker and thinner and more translucent anteriorly. And regulation of intraocular pressure. Some degree of elasticity expand and contract slightly in response to changes in intraocular pressure. Sclera has a role in the transmission of mechanical forces within. Sclera is connected to surrounding tissues by a network of fibers that help to distribute the stresses and strain that are generated during eye movements, changes in intraocular pressure, and this helps to ensure the delicate structures of the eye such as retina, optic nerve, and they are not subjected to excessive forces that could cause damage. Now, scleral apertures. Sclera is penetrated by various arteries, nerves in many places, and we will call such penetration as apertures, and can be discussed as posterior scleral apertures, posterior scleral foramen, and optic nerve, and central retinal artery and veins. The posterior scleral apertures. Posteriorly, sclera is pierced by many structures and can be subdivided into posterior scleral foramen. The posterior scleral foramen sclera is perforated by optic nerve posteriorly, 3 mm medial and 1 mm superior to the posterior pole. So it is optic nerve is 3 mm medial and 1 mm superior to the posterior pole. Here you can see it is present. At this point of optic nerve exits sclera. Sclera blends with dural and arachnoid covering of the optic nerve and becomes a sieve-like membrane internally called lamina cribrosa. Lamina cribrosa, it will be described shortly. Sclera is also penetrated by central retinal artery and veins. Central retinal artery and veins. Other posterior apertures. Sclera is pierced by 8 to 20 short posterior ciliary arteries in a ring called circle of Zinn. Here you can see circle of Zinn header. It supplies the optic nerve head. They are often accompanied by the short ciliary nerves. Little anterior to these are long posterior ciliary arteries. Long posterior arteries are 2 in number, and nerves also enter the eyeball by piercing sclera. This is a long posterior ciliary artery, and these are short posterior ciliary arteries, and they form a circle. Circle of Zinn, also called circle of Zinn-Heller, is named after the German anatomist and botanist Johann Gottfried Zinn. It is circular anastomosis between short ciliary arteries while piercing sclera and supplies the choroid, the optic nerves, and pia mater. The middle scleral aperture. They are situated approximately 4 mm behind or posterior to the equator and represent the exit of the 4 or 5 vortex veins. Here you can see the vortex veins. Vortex veins drain the vein of choroid, ciliary, body, and iris. The anterior scleral apertures are located near the insertion of the recti muscles and allow entry of the anterior ciliary arteries. Each rectus muscle has two anterior ciliary arteries, with exception of lateral rectus muscle, which has only one anterior ciliary arteries. Few special landmark zones of sclera. These are scleral sulcus and scleral spur. Scleral sulcus, on the inner surface of the limbus, there is an indentation or groove. This is known as scleral sulcus. Here you can see scleral spur. A scleral sulcus has a sharp posterior margin, sloping anterior wall which extend to the peripheral cornea. This is scleral spur. And there is scleral roll. Scleral spur is composed of group of fibers, 75 to 80% collagen and 5% elastic tissue, prevents ciliary muscle from causing Schlemm canal to collapse. So it prevents ciliary muscle from causing Schlemm canal to collapse. This is a Schlemm canal, and this is scleral spur. So this scleral spur, it prevents the ciliary muscle, this is ciliary muscle, from causing this Schlemm canal to collapse. Another special landmark zone of sclera is lamina crabrosa. Sclera is thinned with a sieve-like appearance where the optic nerve fibers pierce, and this region of sclera is known as lamina crabrosa. However, through one of these sieves, which is comparatively larger than the others, the central retinal artery and vein enters the eye. As sclera is very weak at lamina crabrosa, it bulges outward in response to long-standing high intraocular pressure, producing optic disc cupping. Blood supply. The episclera receives its blood supply from the anterior ciliary arteries, anterior to the insertion of the rectus muscles, and the long and short posterior ciliary arteries. Scleral stroma is relatively avascular and receives its nutrition mainly from episcleral vascular bed and to some extent from the underlying choroidal vasculature. Sclera contains numerous channels or passages through which the arteries, veins, nerves pass. These channels or passages are also known as emissary channels, emissary canals. These black arrowheads, these are the emissary structures, include ciliary arteries and nerves. The nerves are in the red arrowheads. They are shown entering and traversing normal sclera. Sclera is a relatively avascular structure except for some vessels that pass through the emissary canals. The low vascularity of sclera can be explained with low metabolic demand of the tissue because of the low turnover rate of its collagen cells. Scleritis occurs more commonly anterior to the equator because of the more abundant greater vascular supply. The difference between conjunctival vessels, superficial episcleral plexus, and deep vascular plexus. The conjunctival vessels are most superficial arteries. They are tortuous and veins are straight. The superficial episcleral plexus vessels are straight with a radial configuration. In episcleritis, maximal congestion occurs at this level. Topical phenylephrine 2.5% will also constrict the conjunctival and 10% also the superficial episcleral vessels. The deep vascular plexus lies in the superficial part of the sclera and shows maximal congestion in scleritis. A purplish hue best seen in daylight is the characteristics. Also, the conjunctival vessels, conjunctival plexus are freely mobile. The superficial scleral plexus are mobile over deeper layers, while the deeper vascular layer is immobile. The conjunctival plexus is brighter and red, while the superficial scleral plexus is salmon pink, while the deeper is violaceous. Also, the conjunctival vessels They are congested in conjunctivitis and they are blanched with topical vasoconstrictor. Superficial episcleral plexus, they are congested in episcleritis. They blanch with topical vasoconstrictor, 10%. And deeper vascular plexus, they are congested in scleritis, does not blanch with topical vasoconstrictor. The nerve supply. Sclera is richly supplied with nerves by the posterior ciliary nerves. Posterior ciliary nerves enters the sclera near the optic nerve. The two long posterior ciliary nerves supply the anterior part of sclera, while the numerous short posterior nerves they supply the posterior part.